Hello, Uta here with a few fall dahlias. These are the Jowie Winnie variety. I especially like the stage that one is at. I am back up at the edge up here where I live at the edge of the curated woods, and I'm here to tell the gender doctors that they are taking great risks with the health of their patients. I am the author of the book, In the Curated Woods, True Tales from a Grass Widow. The term grass widow for the ex-wives of cross-dressing men did not take the way that trans widow has taken, so I call myself a trans widow. You can find more of our stories and more truthy bits of factual information at utahagengrasswidow.wordpress.com, and that information is almost always in the notes. Now, pulmonary embolism is what this person, Ray Williams, of Ray Williams' YouTube channel, detransitioner, must be about 36. He said when he was 28 that he decided to claim that he's a woman, and he grew his hair long and was working in a lucrative tech job very similar to Nettie, and met a woman and married her. Apparently, I don't know, who knows what goes on behind closed doors, but he had a pulmonary embolism, which is a blood clot in your lungs, which can kill you, as a result of the fact that he was a smoker at that time, and he got put on probably estradiol, the oral estrogen, which Nettie is also a consumer of. Just, you can take a look at his channel. I felt like I want to make more of a warning out of this, and the comments underneath his videos are very, very telling. I don't make comments anymore on any videos, although I think that I could find more trans widows for my data if I did. The problem is that YouTube is somehow following me around like Pac-Man or something, and writing warnings to me, even if I write, an encouraging comment. So I think somebody over there who's like a Nettie over there in YouTube has, heard of me or something like this. The channel, Uta Hagen, Trans Widow Uta Hagen, my YouTube channel, is not threatened by YouTube. I haven't gotten any warnings directly about that, except the last warning about writing comments under other videos. Even though those videos presented gender critical material, I wasn't saying anything hateful. I said women who used to be married to these guys could find support at Trans Widow Uta Hagen YouTube channel. So I'm relying on you, my subscribers, to do that once in a while, or tell your friends. Please like. I think the likes are important. Probably a couple of my videos have gotten some thumbs down, so please do the thumbs up. Okay, so this is just the basics on Ray Williams, which he publicly says on his channel. He calls his urge to cross-dress for the purpose of arousal to be a paraphilia, also known as, aka a sexual fetish. He was on estrogen for 8 years and then stopped for health reasons, which are that he had a pulmonary embolism. And any doctor who is not addressing the question of smoking while at the same time taking wrong sex hormones is, putting the patients at great risk. Now, blood clots, which is thrombosis, can happen as a result of taking either testosterone in the female body or estrogen in the male body. And of course, Nettie was taking on great risk because in the male side of his family, including our older son and including his father and uncle, there is a very serious family history of problems with cholesterol and heart attacks and strokes, actual ones. My son recovered completely from his stroke, thank goodness, but now he knows that he needs to really watch his cholesterol and be very healthy, and he'll probably live a very long time, and maybe one day he'll speak to me again. But getting back to Ray Williams, he decided to, in quotes, his words, embrace my maleness, but at the same time, he also said, in quotes, he's also going to embrace my queerness, which I don't really get because he's presenting as a straight guy married to a woman. So that's kind of interesting. I have the sense perhaps he's in California. I don't know. Okay, so this is a comment, a rather lengthy one. There's pages of this. This person, Autumn A, underneath the Ray Williams video. And just, this is a person who really just wants to be Peter Pan and not grow up. But he used the idea of the schema, you could say, of that he wanted to be a woman in order to get estrogen, which is helping him to look like what he calls an adult boy. Here we go. Autumn A. Okay, it says 1 month ago and then edited. There's a lot of editing that could have been done. This is really long. I'm glad that I can print these out. I did the same. I take estrogen and have done so for 12 years. I got denied cross hormones by 6 psychologists for many, many years. I then told a new psychologist that I wanted to be a woman and got treated within a couple of months. It wasn't exactly a lie, as I definitely didn't want to be a man. I call those two things really quite different. In my youth, I starved myself through restricting protein and calories to preserve my body at that size. So it sounds like he was anorexic. I was always trying to remain a boy, and few psychologists knew what to do with me, but I ran the clock out in youth. I had to stop the Tanner progressions. So he's saying he desired to stop the Tanner progressions, which are the stages of puberty, which are the sex characteristics, body hair, things like that. And which don't stop even later in life. The blockers, estrogen, and later castration, so he's had an orchiectomy, actually lowered cholesterol, blood pressure, and triglycerides. I don't get this. But anyway, you have to take it all with a grain of salt. And helped me maintain my youth, which is what I wanted. For about a decade, I grew my hair out, put in earrings, and carried a purse. That's as far in the female direction as I could take it. It was a half-assed effort, but I wasn't going to let the sun permanently set on my youth. I had to do it and was scared that doctors would take me off my regimens if I didn't present as female. I've since shortened my hair, pulled out the earring, and carry a backpack. I shall keep the name Autumn and be called he, him. What prompted the change was seeing 3 people live like I always wanted, and it was right at the height of the debate this winter, this is winter of 2023, over banning transgender medicine, so-called, for youth. All of this really affected me. Furthermore, I now have cover with WPATH, because WPATH is now saying that eunuchs, castrated men, are part of their diagnostic structure. Which WPATH allows for a male to identify with his birth gender, get castrated, and then take estrogen as HRT, which stands for hormone replacement therapy, which is a misnomer. Non-binary folks have also done a dance around this as well, but they weren't really well known when I transitioned, which was, I guess, 12 years ago. I guess I have a somewhat non-binary transition, but my identity as adult boy, which is someone who brings all of their physical traits from youth into adulthood and lives an extended adolescence where the sun never sets. Okay, so I'm thinking, I wonder if he had experiences of sexual abuse when he was a child and is very mixed up about something like that. I'm just making conjecture. So Be well. I've lost my screen here. Take care.